Med School. I am Dr. Andrews, Professor of Medicine, Consultant Neurologist. We are familiar with the fact that when you apply nasal decongestants, after a few applications, the efficacy comes down. What's the reason? So this is what I am going to explain today. You should remember two terms. One is tachyphylaxis, second is tolerance. So I will be discussing today what is tachyphylaxis, what is tolerance, and what are the differences between these two. Let us start. Once you take a drug, what happens to it? It gets absorbed. It reaches the liver, undergoes metabolism, that is the first pass metabolism. Then it reaches the blood and reaches the cells. The action of the drug is by getting attached to receptors, either extracellular or sometimes intracellular receptors. The action of the drug on the body is called pharmacodynamics. So what is pharmacodynamics? Pharmacodynamics is how the drug acts on the body. Whereas this portion of the absorption, distribution, metabolism and elimination, that is called the pharmacokinetics. So pharmacokinetics and pharmacodynamics are two pillars of pharmacology. So if you expose these cells to massive dose of drug, repeated doses of drug or constant dose of medicine, what will happen? The receptors on the cells will get saturated. A massive response occurs. Body will try to protect itself, and that is what is called tachyphylaxis. Tachy means, the tachycardia, tachy rapid. So it is a rapid effect, and phylaxis means protection. So it is a rapid protection of the cells. Now we understood that this is a protection of the cells from stimulation, overstimulation, when the cells are exposed to large dose of medicines. Let us think how it happens. There are different mechanisms. We'll take one by one. First is shutdown. A rapid protective shutdown is occurring. One of the mechanisms is decrease in the synthesis of the receptors. Second is the receptors get internalized. These are the receptors will get internalized. So the number of receptors are less and the number of receptors for exposure to drug is less, so action will come down. Third is phosphorylation of the receptors. The receptors will get phosphorylated and then it binds with the beta-arrestin. And once the beta-arrestin attaches to the receptor, it becomes inactivated. So it is a phosphorylation of receptors. These are some of the mechanisms at the level of the receptor or pharmacodynamically that is happening. There are other mechanisms which we will discuss later. So what is tachyphylaxis? Tachyphylaxis is characterized by acute decrease. That is a term you should remember. It's an acute decrease in the response to a drug after the initial administration. So I already mentioned decrease of receptor synthesis. So loss of receptors from the target site decreases the response regardless of the drug dose. So these are number of receptors that are synthesis. Receptors are less. So even though drug is there, the drugs cannot act there. Next is we have mentioned the receptor phosphorylation. the receptors are phosphorylated, and what happens, the arrestin will come and attach to this, and the receptor becomes inactivated. This is the mechanism seen in beta agonist. When opioids are given, the receptors are getting inactivated. The third mechanism is receptor internalization, that also I have explained. These are the receptors are there, the receptors are internalized. So less number of receptors are exposed to drugs. So drugs are coming and hitting at the door, but the door is not there. That is the mechanism that is happening in the receptor internalization. So in summary, tachyphylaxis, it is a mechanism, decrease receptor synthesis, receptor phosphorylation, receptor internalization. These are things that is happening at the level of the receptor, and all this leads on to the point to be remembered. So suppose you are giving rapid dose of drug, repeated dose of drugs, or a constant infusion of the drug, the action comes down. Even if you increase the dose of drug, the desired effect is not there. So in tachyphylaxis, increasing the drug concentration fails to overcome the diminished response. That's the reason the receptors are not there. That is an important point to remember. So whereas in contrast to this, there is something called tolerance. Tolerance, the key word is, it's a chronic exposure. There is a gradual decrease in the responsiveness. Whereas tachyphylaxis, the word is, remember, is the rapid. It occurs within hours or minutes. So tolerance occurs on chronic exposure. So tolerance develops over hours. So it occurs over hours or days or even weeks. It is due to chronic use, repeated daily dosage. For example, alcohol use, benzodiazepine use, opioid use, etc. The mechanisms are almost similar. One is at the level of the receptors. Second is enzyme induction. So that is another important point. You remember, there is one is a receptor. It is almost similar. There is a down regulation of the receptors, either by decreasing the synthesis, internalization, or phosphorylation. Then enzyme induction. We all know about the cytochrome P450. Some of the drugs are inducers of this enzyme. So what will happen? They will metabolize so the enzymes are induced, the drug comes, the drug is metabolized by the enzyme. So on the cell, there is nothing much no drug to act on the cell. So that is the mechanism of the tolerance. So as mentioned, tolerance, receptor down regulation, that by internalization, decrease the receptor synthesis, or some other mechanisms. The increase in metabolism or metabolic enzyme induction. I mentioned about the cytochrome P450. Many drugs are inducers. For example, alcohol. Alcohol increases the synthesis of alcohol dehydrogenase, which is an enzyme that destroys alcohol. So more amount of alcohol is required for the desired effect. Same thing, barbiturates, carbamazepine, rifampicin. So enzyme induction accelerates the drug metabolism, lowering the effective concentration of the site of action. So less amount of drug is available on the receptors. So the important question is, can tolerance be overcome by increasing the dose? Yes. Whereas tachyphylaxis, it cannot be, because tolerance is partly due to the faster metabolism of drug. For example, the enzymes are induced. Suppose you give more drug, more substrate is there, the enzymes cannot destroy all the drug. So remember, tachyphylaxis is not reversed by increasing the dose, whereas tolerance can be reversed. So the key differences are given in this chart. The important point to remember, increasing the dose, tachyphylaxis will not be, and the tachyphylaxis is a rapid within hours or minutes. So mechanism I already mentioned. The examples are tachyphylaxis, nitrates, ephedrine, is nasal decongestants. For example, tolerance is opioids, ethanol, benzodiazepines. So, some of the examples of true tachyphylaxis you can remember by mnemonic 9T. N for nitrates, I for indirect symptom mimetics, N for nasal decongestants, ephedrine, T for tobacco. So, examples are also given. In the next session, we will be discussing about therapeutic index, and I explain the affinity, efficacy will also be reviewed. Hope it was useful to you. Stay tuned for further videos. Thank you.